Welcome back to the channel. In today's video, we're going to be talking about a group of muscles that are often the silent cause of hip imbalances and medial knee weakness and pain. The adductor muscles. These muscles play a crucial role in stabilizing the hips and pelvis. And when they are weak or imbalanced, it can lead to issues throughout the entire lower body, especially on the inside of the knee. In this video, we're going to go over the anatomy of the adductors, how they affect your movement and stability, and of course, I'll show you some exercises that can help you fix the overall issues. Let's dive in. Let's start by looking at the anatomy of the adductor muscles. The adductors are a group of 5 muscles located along the inside of your thigh, and they include the adductor magnus, the adductor longus, adductor brevis, the pectineus, and the gracilis. These muscles are responsible for adducting your leg, which means bringing your leg inwards towards the midline of your body. Think about crossing your legs or squeezing your thighs together. That's your adductors in action. But they do much more than that. The adductors also play a major role in stabilizing the hips and pelvis during everyday movements like walking, running, or even standing. When these muscles are weak or imbalanced, it can cause your pelvis to tilt to one side or your hips to shift out of alignment. This often leads to dysfunction elsewhere, especially in the knees. You're probably asking yourself, how do weak adductors affect the knees? Well, when the adductors aren't strong enough, your knee can start to collapse inward during certain movements like squats, lunges, or even just walking. This inward movement, also called a valgus collapse, puts a lot of stress on the medial part of the knee. Over time, this can lead to knee pain, instability, or even injuries like medial meniscus tears or ligament strains. So if you've been dealing with knee issues, the problem might actually start higher up in the hips and adductors. Now that we've covered the anatomy and how weak adductors contribute to hip and knee problems, let's get into some exercises that can help strengthen these muscles and restore balance. First of all, we've got the standing adduction with a resistance band. This exercise is great for directly targeting the adductors in a functional standing position. Attach a resistance band to a sturdy object and loop it around one ankle. Stand tall with your legs slightly apart and then pull the leg with the band inward across your body. Control the movement as you return to the starting position. You can perform 10 to 15 reps and then switch legs. This movement strengthens the adductors while also challenging your core and hip stability. Exercise number 2 is the level 1 Copenhagen plank. This is probably one of the best exercises for targeting the adductors, but you need to make sure you do this in stages. Get a gym mat and a bench. Place your elbow on the mat as shown on the video, and then place your top leg on the bench, with your knee being on the soft pad. You can keep your leg straight or bent. I personally prefer to bend it. From here, lift your hips up so that your top leg is in line from knee to hip to shoulder, and don't look down. Keep your eyes front and your top arm on the side of your body. Hold there for 15 seconds, or if you can, go up to 30 seconds. Make sure you rest between sets, as this exercise can be challenging. You can do 3 sets of 15 to 30 seconds per leg based on your ability. This is an excellent isolation exercise for targeting the adductors, helping to strengthen them without using other muscle groups to compensate. Exercise number 3 is going to cover the split squats. Split squats are a great way to strengthen not just the adductors but also the glutes and quads. Start with your back foot up on a bench and find your balance with your front foot. Do this body weight first before adding resistance. You have 2 options here. You can go down to 90 degrees with the knee bent and come back up, or go lower into a deeper knee flexion as much as you can and then come back up. Both options are good for getting the adductors to fire alongside the glutes and quads. Whichever option you choose, just make sure you do a 2 to 3 second pause at the bottom of the movement. Perform 10 to 12 reps for 3 sets. This exercise works the adductors in a more dynamic movement while promoting better hip stability. These exercises are excellent for strengthening the adductors, but it's important to note that balance is key. You also want to make sure you're working on your glutes, core, and other muscles around the hips to create stability throughout the entire lower body. And don't forget about flexibility. Tight adductors can also be an issue, so stretching them regularly is just as important. Here's a quick stretch you can do. Sit on the floor in a butterfly position, bringing the soles of your feet together. Gently press your knees towards the ground to stretch your inner thighs. I like to personally add a kettlebell to this exercise in order to gain a better stretch. Hold this stretch for a minimum of 2 minutes in order to maximize its effects on the muscle tissue. This will help keep your adductors flexible and promote better movement patterns. By strengthening and stretching the adductors, you can not only fix hip imbalances, but also prevent and reduce knee pain. The key is consistency. Incorporate these exercises and stretches into your routine, and over time, you'll see improvements in your overall stability and movement. Thanks so much for watching. I hope this video helped you understand the role of the adductors in hip and knee health. If you found this helpful, be sure to hit the like and subscribe buttons for more content like this. If you have any questions, you can drop them below in the comments and let us know what you want to see next. Take care, and we'll see you in the next video.